Well, thank you for hosting this session. I'm Phil Wu. My primary vocation is a pediatrician with Kaiser Permanente, and my avocation is primarily advocating for healthy eating, active living kinds of activities. So, Jelly referred to the transportation equity and social justice stuff, which is really my primary area of interest. The fluoride issue resonates with me primarily because of my interest in pediatric health and the fact that I think we're now all beginning to understand that oral health is a gateway to the rest of your overall body health. So essentially, as your mouth and your teeth go, oftentimes the rest of your body will follow. So it's an under-recognized area of concern. I'm going to, since I'm told you're all a very thoughtful group and a very deliberate group, I'm going to try to not do the usual campaign kind of speech and really approach this from the perspective of the public health issue at hand. And why it is that I and I think others in our coalition feel that water fluoridation is really important for public health. I come from the perspective of what other things do we face from a health perspective that we have considered to be essentially epidemics. You could look at that in a number of ways. The number of people who smoke, the number of people who get lung cancer, the number of people who have breast cancer. All of these numbers, of course they vary. But one of the numbers that is significant and I think under-recognized is that approximately half of all kids have dental decay. And of that group, 1 in 5 have untreated rampant dental decay. And a good number of those kids are in exactly the communities that we worry about. So these are the low income, the underserved, and communities of color. So those that have the least wherewithal to be able to handle this problem. So from a public health perspective, this classifies as an epidemic. A 50%, thereabouts, a 50% rate of dental decay is, by all accounts, an epidemic. And it deserves very careful public health attention as to how we deal with this. We're living in a climate of healthcare reform. Oregon is leading the country in healthcare reorganization. The CCOs are just getting started. There are financial implications to us in Oregon and to people in general if we fail or if we succeed at healthcare reform and healthcare transformation. It's pretty clear that we have to engage in pretty serious upstream preventive healthcare measures for healthcare transformation to work. Meaning we have to prevent people from even getting to a place where they start having medical difficulties. Because once they're there, it's incredibly expensive to go after that and to try to treat it. So much better to be upstream and prevent. Oral health is one of those things that is, at the moment, very expensive. It adds a huge burden to our healthcare costs, and of course it adds a huge burden to the morbidity that the people actually experience. So, those numbers, 50% of kids have untreated dental decay. 1 in 5 have rampant, 50% have dental cavities, 1 in 5 have rampant untreated dental decay. This cascades through life. Okay, once you get a cavity, it doesn't go away. You are simply coping with it, with a filling, or 2, or 3, or 4. Most of you as adults, if you've had a cavity, you know one cavity filling doesn't stay there. You get it replaced time and time again. And there are potential complications to that cavity, which cause further trouble. So the statistics show that by the time you are 65 years old, 93% of people will have had an experience with dental decay. And in seniors over 65 years of age, almost 1 in 5 seniors have untreated dental decay. So almost exactly the same as what's happening in kids, except the majority of seniors will have had a problem with cavities. So this is a problem that's not limited to just the pediatric population. It ramifies through the population as we all age. And it's a significant health burden. So a comprehensive dental health program involves many, many things. Right. Yes, it involves access to dental care. Seniors oftentimes don't have very good access to dental care. Communities of color, low income, underserved have very poor access to dental care, if any at all. But access to dental care is one pillar of a comprehensive dental care program. Using things like dental sealants, the personal hygiene that we all hopefully practice. Those are all of the additional steps in a comprehensive program. Obviously, good nutrition. Yes, if we were able to eliminate all of the sugar in our diets, avoid all of the sugar-sweetened beverages, not only would we take care of oral health, we would also take care of obesity. And that was one of my areas of specialty in Kaiser Permanente, was childhood obesity. So those are all important to do. But the other cornerstone of a comprehensive dental health program is water fluoridation. The National Academy of Sciences, which has published a number of comprehensive reports over the years, in 2011 produced a comprehensive report on oral health in America. And again, they had identified all of the elements of a comprehensive dental care program, including water fluoridation as a cornerstone. Now, this is not a panacea. This is not the end-all or be-all of prevention, but it's an important part of it. And it's especially important for those people who don't have access or poor access to the other elements. So, water fluoridation, it's been around for 56, 60 some odd years. You've all heard that Portland is the largest metropolitan area that doesn't fluoridate. A couple 100 million Americans consume fluoridated water. A number of Oregon cities already fluoridate, some of them rather surprising. So this is not rocket science. This isn't brand new. The safety issue is well established. You don't have 60 years of a track record and not have safety well documented. That's why the Center for Disease Control, my professional organization, American Academy of Pediatrics, heartily endorses and recommends water fluoridation as safe and very cost-effective compared to every other intervention that you may want to do to improve oral health. Okay. Locally, this debate is back and forth with all kinds of quotes about this study, that study, this study, that study, and it's all very confusing. It's hard to interpret. Well, 6 of our local
That's your time.
newspapers have endorsed our campaign based on their review.
Thank you for welcoming us here. I wanted to start by saying why I'm doing this, my own personal story. Up until 5 years ago, I was fine with fluoridation, thought it helped the kids and all that, and a lot of these organizations, not all, had endorsed it. And then a friend of mine called me and said, would you look at the science on fluoridation? I said, yeah, I can do that. So I started looking, and I was amazed and very concerned at what I saw. My main source was the most comprehensive, authoritative report put out by the National Academy of Sciences. Neither side criticizes this. This is how good this is. A Blue Ribbon Committee of 12 scientists put this together. And I saw so many red flags in here that I got very concerned, and the more I read, the more concerned I got. So that's why I'm here. And I just wanted to say the two things I saw that really knocked me for a loop to begin with. One, teeth are very important, but they were only a very small part of the fluoridation story, because the other health effects on the body, the harmful risks, that was the much bigger story. That was one. And second, there are a lot of organizations in the U.S. that support it, and the U.S. government. But what struck me was how many other organizations and governments around the world did not. We are a very small minority here, 196 countries, 27 fluoridate, only 11 like the U.S. for more than half their population. If you look at Europe, you were looking at 43 countries out of 48 do not fluoridate, and what do they cite as their reasons? And this is all a matter of public record. They have health concerns, they have effectiveness concerns, and they have ethical concerns, because this is putting in the drinking water a drug, as defined by the FDA, and Phil may disagree with me on this. I have the documents from the FDA, you can see them afterwards, that says this is a drug and they have the authority to regulate it. The Europeans see it the same way. And when they say, if you're putting a drug in the drinking water, you can't control the dose. And no other drug is like this. And people are not giving their informed consent. It is a real ethical issue, and I see it the same way. To start, the chemical, what are we putting in the water? We got some of the best water. If you've lived other places in the country, you know how good Bull Run water is. This is some of the purest, cleanest water in the country. The chemical that goes in is called fluorosilicic acid. It is an industrial byproduct of the phosphate fertilizer industry. It is classified as a hazardous waste if it was not being sold to municipalities or for an industrial reason. It would have to be disposed of at a hazardous waste facility for 3 reasons. 1, it's so corrosive. 2, it does have high enough levels of lead and arsenic in there to qualify as this, as per the EPA. It's legal. It's not an illegal practice, and they dilute it down, that's for sure. But those substances are still there. The EPA has said there are no safe levels of lead or arsenic. There are no safe levels. We had a test done on the same acid being used to fluoridate Phillip. This just came out last week. We had an independent lab test it, and then we had a former scientist very high up who worked for the EPA test it, look at the figures, and what he concluded, running the EPA's figures, this would increase the number of cancer cases in Portland area by 5, just the arsenic, and this is not the main point, by 5 cancer cases per year. So it is something. The other thing with lead, or with this particular chemical, there are definitely recent scientific studies that it may be leaching lead out of old pipes and with the use of a particular chemical, chloramine, in Portland's water. And we're not going to go past the science. We don't do that. I am very careful personally and as an organization. There is not 100% proof of this, that it will leach lead. There are significant scientific data pointing in that direction. Our stance is better safe than sorry. If you can't say it beyond a reasonable doubt that it's safe, it should not be in the drinking water in the first place. If you would look at the, oh, I got to get one of these blue sheets here. Can I get one of those back? Thank you. Thank you. This report here, again, the most well-balanced, authoritative, comprehensive report ever done. What they identified and what caught my eye so much were these. This whole list here, and there are actually more I couldn't fit in. And they were saying that these are either a definite risk, fluoride is either a definite risk or a prospective risk to all these. Everything from bone cancer to lowered IQ, diabetes, thyroid disease. On the back of this are quotes I've just taken out of this. And I've been through a lot of debates, as Phil could attest to, we both have. The other side said, well, you're taking these quotes out of context. You can decide for yourself. This report is online and free, and we have put the page numbers in here so that you can go right to them and see if you really think I've taken these out of context. This is what concerned me so much when I started researching this. And the more I researched, the more concerned I became. And some quotes from the scientists themselves. In 10 minutes I can't do much on the science. I just want to tell you some more personal stories though. Angel, on our committee, Angel Lambert, 35-year-old mother of a 2-year-old. Angel has hypothyroidism, low thyroid. She has typical symptoms, knee joint pain, gained a lot of weight, and had a very difficult time with fatigue. Her doctor has told her, the last thing you want as a hypothyroid patient is a substance that has been, this is confirmed, we know this, fluoride lowers thyroid function. Last thing you want is something, by the way, her doctor is a thyroid specialist, said you cannot ingest fluoridated water. Malgosia is a doctor herself. She's a child psychologist, not a medical doctor. She has chemical sensitivities. A lot of people have these. We're talking thousands of people. Her doctor, her medical doctor, has told her you cannot consume fluoridated water. And Mike, this is kind of a younger crowd, you may not remember. Mike Lindbergh is a former city commissioner of Portland. Mike used to think like I did, that fluoride was fine. And then he was diagnosed with excessive arsenic in his body. His physician has told him, you cannot ingest fluoridated water. It is often contaminated with arsenic. You cannot do it. It is going to harm you. And then you've got parents of babies. And we know this, even the CDC says this, because we don't want to get fluorosis. Fluoride causes fluorosis. Infants, especially up to 6 months old, should not be mixing fluoridated water with their infant formula if they're doing it. Breast milk is best. We know this, and we know that fluoride levels in water are 100 to 200 times greater than in breast milk. This is not a nutrient. We don't need it. And in fact, mother's milk, mother's bodies seem to have a very protective effect about fluoride getting into it. So this is something, and this is a social justice issue, because if you've got all these people that do not have enough money to avoid fluoridated water, then they're kind of in a pickle, and we just don't think this is right. These are real people with real medical conditions and real doctors, and they are telling them this is going to be a real risk to their health. Effectiveness, we don't have time to get into this a lot. You're going to hear a lot of percentages thrown around out there about what percent fluoride can lower cavities. The biggest study ever done in the United States, the National Institute of Dental Research, found only about a half a cavity difference between, this is per kid, per childhood, from fluoridation. That's it, not even statistically significant. The SMILE survey, it just came out. Every 5 years, the Oregon Health Authority. Unfluoridated Portland had lower cavity rates than the combination of fluoridated cities in Portland. And I wanted to say something about, I'll save that. We got 1 minute or less. To us, a very big deal here is choice. Right now, everyone in this room and in this city has a choice whether to ingest fluoride or not. If you put this in the drinking water, you have taken away that choice for so many people. Some people can spend hundreds, maybe thousands of dollars on a filter system. Maybe they could afford it. Other low-income people cannot. You're taking away that choice. This is an ethical issue. We do not think you should take away that choice. We do not think you should have fluoride in the water for that reason alone, and many others.
Yeah, I think really all I want to say is just to add some clarification to some of Rick's points. First of all, the 2006 National Academy of Sciences report. And it's absolutely true that we all refer to that report as essentially the most comprehensive review of fluoride in water. However, this report was dedicated for the purpose of looking at areas which had natural levels of fluoride well above what we would consider to be water fluoridation for oral health purposes. So this is a very much an apples and orange kind of situation. Again, this is the very same National Academy of Sciences that produced the 2011 report on oral health in America. So we're talking about the same scientific body that is essentially supporting water fluoridation as a part of a comprehensive dental health care program. It is absolutely true that if you ingest too much of anything, there are going to be health risks. Too much of anything good is potentially bad. That applies to things like vitamin D, it applies to calcium, and it applies to water itself. So there's no such thing as something that you swallow or ingest that, if taken at an excessive level, won't have toxic effects. There's no such thing. All right, so the important thing is we are talking about water fluoridation at 0.7 parts per million, which is 0.6 parts per million above what is already in our water. So it would be a mistake to think that you are not already consuming fluoridated water. You're just consuming a suboptimal amount for the purposes of oral health. All right. People who are sensitive to fluoride are already getting fluoride. All right. So, number two, the social justice issue, I think, is an important one, because right now, the absence of water fluoridation harms a significant portion of our community. And I think it's a little disingenuous to say, to flip it around and say that having water fluoridation present means that those communities can't afford to take it out, and therefore it's a social justice issue in reverse. It's very much a social justice issue that those communities experience significant oral health problems and could be benefited by water fluoridation. That is the true social justice parameter. And then finally, this SMILE survey. Yes, Portland does better than the rest of the state of Oregon. But this brings in all of those elements that affect oral health above and beyond water fluoridation. Portland is a richer city. Socioeconomic factors correlate directly with oral health and dental decay. Dental sealants are much more widely used in Portland than they are in rural Oregon. So a public health epidemiologist will tell you you cannot compare those kinds of disparities. Right? It's not a reasonable comparison. There are a whole bunch of other factors that play into those different rates. And still, we are talking about 52% of kids experiencing dental decay. So no matter how you cut it, no matter how much improvement may have occurred over the past, let's say, 7 years, that rate is still too high. And it takes public health measures to make a bigger impact.
Just to respond to some of Phil's points and a couple of others. In terms of the National Academy's report, this is by far the most comprehensive. There's ones afterwards, 1,100 studies they looked at. And as far as the only extremely high levels that this pertained to, all you got to do is read it. It doesn't say anything about it, 4 parts per million or more. It's just fluoride itself. And this is a very important point here. It isn't just the level, it's the dose. It's the total amount you're taking in, okay? And that's a key element here. When you put it in the drinking water, you can't control the dose. If you can't control the dose, you can't control the harm, because this is a toxin. Ingesting too much of anything, vitamin D, calcium, water. Vitamin D and calcium, they're nutrients. This is not a nutrient. And vitamin D and calcium and water are not classified as hazardous wastes that would have to be disposed of. This is. What they're putting in the water, at the level they're putting it in, is classified as a hazardous waste. That's the difference. Portland, the SMILE survey, it's interesting here because in the 2007 survey, the other side was quoting that a lot, saying, well, we're really doing well, or doing badly here in terms of oral health. When this comes out showing that Portland, non-fluoridated Portland, has a better record, it also showed that in terms of dental access, it was virtually the same as these cities. And I've got that right here too, and I can show that to you. So, person to person, kid to kid, they're getting to dentists as much. It's not that Phil isn't correct and that there are a whole lot of other factors. We do realize that there's no magic bullet, and we agree on that point. But when you look at the SMILE survey, it's really, really something and very revealing. That's not the only one. You look at cities all over the country, San Antonio, 9 years, $3 million worth of fluoridation. And their decay rate for low-income kids actually went up 13%. You look at Pittsburgh, Cincinnati, this is all a matter of public record. They're online and you can see them. Boston, Detroit, the same dental problems that we have here or worse, and they've been fluoridating for decades. It doesn't work. The best study, the other side was saying this is the best study, the Iowa study, showed fluoridation fluoride works topically, almost topically, has very little effect ingesting. Even the CDC admitted that. And in terms of, I have to bring this up, but one, you've heard the health effects, you just got a very sample of them. Here's the other sides. I'm sorry, I have to bring this up. I don't mean to be confrontational, but I got to bring it up. You may have got this gigantic flyer in the mail here. And what do they say? You've heard just a little bit about the health effects and about real people here, and they're real doctors saying they got real problems. What do they say? Water fluoridation is entirely safe, zero negative health effects. They're actually talking about putting a known neurotoxin into your body, no control for dose, and that all it's going to do is help teeth and not have any other effect on your body. That is simply not plausible. And Phil, you're talking about you cannot compare cities. One other ad, this I got to bring up. This is the TV ad that first came out. The TV ad. You can't compare cities and just say it's one factor. That's Portland. We have 40% more untreated tooth decay than Seattle because they fluoridate their water and we don't. There's one reason they get. Look at this very closely. Untreated tooth decay. Okay. Untreated tooth decay. We're not talking about the effectiveness of fluoridation. We're talking about the healthcare system. We're talking about access to dentists. And they're using that to justify fluoridation. This has nothing to do with the effects of fluoridation. I'm sorry, this is one of the most deceiving ads I've ever seen. This is not an accident. This is not an exception. This characterizes the campaign, and I'm going to say it. These kind of statements are put out there all the time, and most people will never see this. We want social justice. This is not reversing things, Phil. This is people, tens of thousands, if not hundreds of thousands of people that want to avoid fluoridated water. And many of them are low-income communities of color. and they're not going to be able to. And that's not right.
We're going to go into questions and answers. Some of these questions go to one or the other of you. And we agreed beforehand that we limit the answers to 2 minutes or less, and everyone will have a chance to, both guys will have a chance to respond to the question. The first category that I see a lot of is just people want to know, does fluoride work or not work? Is it effective or not effective? And that's expressed in a lot of different ways. How does Phil respond to the, and maybe we'll start with Phil on this one, 2 minutes, and then your response. How does Phil respond to the tooth decay trends of fluoridated versus unfluoridated countries over time? And Peter passed this up. How do you explain this bottom part of the chart? And by that you mean the fact that tooth decay is going down, it seems to, over time. So, and just to express some of these other questions that are in the same vein. Phil, I received regular fluoridation at the dentist as a child. I still had a significant amount of decay. What is the proof that fluoride actually helps? How do we know fluoridation is the answer to dental decay in this age of excessive sugar consumption? What data exist? Does Phil believe there are absolutely no respected studies that state, well, that's a slightly different question. So let's just talk about effectiveness of systemic fluoride to treat tooth decay.
Sure. Fluoride works both systemically and topically. The systemic effect is really primarily in children before their teeth erupt. That's when fluoride incorporates into the enamel, builds the enamel so it's stronger to begin with. So when the tooth erupts, it starts out essentially better off than it would have otherwise. Once the tooth is out, then Rick is absolutely correct. The benefit of fluoride is all topical. Fluoride remineralizes the enamel on the teeth. But oral fluoride, when you swallow it, works topically 2 ways. One is, it's appearing in your saliva 24 hours a day. When you are sleeping, eating, drinking, as long as you've got saliva in your mouth, fluoride will be present in your saliva in low quantities, but it's a constant bathing process. And the second is, presumably you are drinking water multiple times during the course of the day. 5 times, 6 times, 8 times, you're sipping from glasses, water bottles, whatever. And so you are also bathing your teeth with fluoridated water multiple times during the day. So you are having many kinds of contact to topical fluoride. So that's how fluoride basically works. All right. I'm not sure about the other part of the question.
Effectiveness of systemic fluoride.
Okay.
Rick?
Phil, you never cease to amaze me. As many of these things as we've gone through here. Fluoride does not work pre-eruptively. It has nothing to do with that. My gosh, even the CDC said that. And there are multiple studies out there that have been done. It used to be thinking like that, but no, it doesn't. And in terms of this whole business with the saliva, the level of fluoride in saliva is minuscule, just minuscule. And that Iowa study that I cited, that even the other side cited, they didn't say anything about saliva. They were just talking about the simple effect of ingestion, saying that was not a major factor at all. In fact, they even went so far as to say that the use of the term optimal, as in 0.7 parts per million, was, quote, problematic because of the fluorosis. They knew it was increasing fluorosis, the staining of kids' teeth. That graph that you saw, that was what the first part of that question was on the handout there. it was thought here in the United States, the story was, well, we've increased fluoridation and cavities have come down, therefore it works. Correlation is not necessarily causation. Because what was happening as U.S. cavity rates were coming down, as that graph shows, and that's just World Health Organization data put on a graph, that other countries were coming down every bit as much or more. And there are a lot of reasons for this. We think it's better nutrition, better dental habits, more access to dentists. There are a lot of reasons put out for this. But it had nothing to do, these other countries, with fluoridation. Nothing. Was there?
Other options for treating dental health issues besides fluoride in the water? If not fluoride, Rick, what is your proposal for treating dental health issues in Portland?
Well, again, Phil and I would agree on something, that there is no silver bullet, magic bullet that's going to take care of all dental problems. It's multifactorial. One, some of these are very, very simple. Brushing. And maybe I forgot to say this. We have no problem with dental fluoride applied topically. I mean, I brush with a fluoridated toothpaste. We have no problem with rinses, dental treatments for those people who don't have chemical sensitivities. No problem with that at all. It's the swallowing. That is where the problems start. So in terms of solutions, just better dental health at home. Nutrition is huge. If you got kids drinking fruit drinks, soda especially, processed foods, this can be deadly on teeth. You've got to really take a look at nutrition. Third is access, and here's where the low-income kids come in. What's interesting is the two SMILE surveys, 2007 and 2012, Oregon's cavity rate came down 19%. This is without any significant fluoridation. So we were doing something right, and the big thing, a real thought here is we are getting to low-income kids better than we used to. Washington State has a program called ABCD that works especially with Medicaid families and their kids, trying to get medical practitioners to catch decay earlier. And that has been very, very successful, as why they've cited in Vancouver. Over the last 5 years since they started this, that is what has lowered their rate. So it isn't easy, there's no magic bullet, but those we see, and sealants, we would say sealants also, those are the major factors to us to work on to prevent cavity.
Phil?
Well, I think the problem I would absolutely agree that all of those measures are highly worthwhile. The problem is that they are all very expensive, and they are all exactly the things that are subject to budget cuts and lack of overall public support. So, as an example, we didn't get into the cost of what this whole fluoridation thing would potentially entail. But for the average Portland resident, it would be $5 per year for the first, $5 for the first year, which is setup, and then 61 cents per year thereafter. Currently, fluoride tablets cost $50 per year. Over-the-counter fluoride rinses, if you were to do that on an annual basis, is $14 per year. Topical fluoride applied in the dental office is $60 per year. Prescription fluoride gels are $51 per year. You add all that up, and that's a tremendous financial burden, especially for low-income individuals. The beauty of water fluoridation is it takes no outreach. You don't have to target certain populations, use manpower to reach them, and then implement a specific program. That adds expense, and that's exactly what is highly variable in our current system of funding anything in our country. And those are the things that typically go. Water fluoridation is automatic. In other words, we all do it. We do it without thinking. It takes no outreach, no thought. You're just doing it every day as a part of your normal everyday life.
Another question for you, Phil.
Do I get a chance to respond?
I think that was his
I was
response.
responding.
Oh, you responded to one. Okay,
Yeah.
I'm sorry. Yeah.
Thomas writes, I tend to believe that the risks associated with fluoridation are overblown and based on unrealistic levels. My question is why more advanced nations do not fluoridate?
Well, actually, that's a really good question. Other advanced nations actually do believe in fluoridation. And this is going to get into the whole back and forth issue about who does and who doesn't, and why don't they do it. But the World Health Organization enthusiastically supports water fluoridation. Individual countries make decisions about how to fluoridate based on the conditions in their country. So, a couple of countries in Europe fluoridate salt. A couple of countries in Europe fluoridate milk. Italy doesn't fluoridate water. They don't do it consciously because they happen to have natural levels of fluoride that are high. And there's a cultural tradition in Italy to drink bottled water rather than use municipal water. So it's a fallacy to say that European and other advanced countries don't believe in the effectiveness and safety of fluoridation. They have in fact chosen other methods of fluoridating based on their infrastructure and issues like what kind of dental care access they provide. And let's face it, a lot of European countries have what we would refer to as socialized medicine, which means they have a much more comprehensive blanket oral and medical benefit package.
Rick?
Yeah, let's take Europe because you're going to hear these sound bites and you want to get beneath the sound bites. Why aren't they fluoridating? For one, you can just look. This is a matter of public record what their health ministers are saying. And it has nothing to do with salt or milk or bottled water. It's because of health reasons, effectiveness, and it's because of the ethics. Because they don't believe you should be putting a drug in the drinking water. In terms of this, let's get some specifics though. Salt. 5 countries out of 48 have salt available. And every one of those, you go into a grocery store, you pick fluoridated or non-fluoridated salt. It is a consumer choice. Milk, 3 countries. We're talking about a minuscule number of people throughout Europe having milk in their fluoride in their milk. Okay? And the same thing, it is a consumer choice. Bottled water, yeah, there's bottled water that has high levels of fluoride. There are also hundreds of brands of bottled water that don't have any fluoride or very little. And it's the same thing. It is a consumer choice. When you put this in the drinking water, for so many people, you are taking away that choice. And you talk about costs. You're talking about $5, $1. Okay, put yourself in the place of those tens of thousands of families in the Portland area that cannot, because of medical reasons, ingest fluoridated water. Okay, it's not $1, it's not $5. You're talking hundreds of dollars a year for bottled water. Or you're talking at least $500 or $600 for a fluoridated water for a filter. You cannot get it out with those cheap filters. This is the real cost. The health problems are the real cost. And that is what all their economics do not even deal with. They do not even deal with the cost of fluorosis because right now 41% of 12 to 15-year-olds, it has skyrocketed because of fluoridation. So many of those, it is staining their teeth. Some of it's very mild, you can't see. Others is not mild, it is moderate, sometimes, rarely, but severe. And there you're talking about some kind of cosmetic treatment.
That's time.
And
Question to Rick. Do you have a sense of why fluoride is so troubling for so many individuals, why it's used so widely, and why it has so much support from institutions?
that is an excellent question. The same question I asked myself, like, why is it that so many of these organizations support it? Not all. But the short answer to this question, I don't know. I don't know how anybody could look at 1/10 of what I've read and still support fluoride. I don't know. I freely admit that, because there are so many red flags in here and other things that you look at, the statements from the European countries. I don't know how anybody could. So that's my short answer. The longer answer is not all organizations do support fluoridation. You go down this list, the National Academy cited, American Cancer Society, Diabetes Association, Kidney Fund, American Thyroid Association, the Endocrine Society. None of them are on record as supporting fluoridation. They don't oppose it yet, but they are not supporting it. Here's the thing. It seems to be like, well, science precedes. You know, at one time, we thought lead in gasoline was safe. One time we thought DDT was safe. Asbestos, tobacco. We thought all that was safe. The government, medical organizations that said it was safe. As the science came in, they changed the rules, changed their positions. But I have never seen anything quite like this. It almost seems like when the government first came out and okayed fluoride in 1950, they gave their stamp of approval. The Dental Association hopped on real quick, and then the Medical Association. And then it seemed to be this bandwagon effect. And it's almost like, and more, it's kind of like an echo chamber. Never seen anything like it. But if you go around the world, you got a list like this here, go around the world, they're looking at the same science, and yet they've come to the exact opposite conclusion. The same one that I came to, just by doing some reading, just by connecting some dots.
That's your time, Rick. And now, Phil, you got 2 minutes to respond.
Well, this isn't a matter of the blind leading the blind, just to put it bluntly. And, you know, the Center for Disease Control is not in the business of perpetuating a myth. The American Academy of Pediatrics is not in the business of giving faulty, non-evidence-based advice. So, the National Academy of Sciences and reports like this are comprehensive. But the bottom line is, the final interpretation is that water fluoridation has proven to be safe and effective. Organizations that deal with the thyroid or the kidney, they don't take a position because the issue of fluoride isn't germane to their mission. So they don't say yes, they also don't say no. But not taking a position doesn't mean that they are saying this is a dangerous health factor. All right, the American Cancer Society doesn't take a position on whether fluoride is good or bad, but they do say on their website that there's no sign that water fluoridation causes any increase in cancer. So this is an example of putting a spin on a non-position that is simply not accurate. Every respected healthcare organization, and we're not doing this because we're conspiring, that we're being led by someone else, but every major healthcare organization supports water fluoridation because of its safety and its cost effectiveness.
Quick question, do either of you receive compensation for your advocacy?
Me? No. Absolutely not.
I'm a volunteer.
Yeah.
A couple questions are related to Portland's role in all this. Can either of you, and maybe we'll start with Rick, speak to Portland's unique history around fluoridation, and if not this, what? I believe we've kind of touched on this, but there's a few questions about if topical works, how do we continue topical? If it's important to treat with fluoride before teeth erupt, are there other things we can be doing with children and babies? So if Portland's going to have their unique take on this, What will it be? And is it important that Portland has a unique take, or should we just play nice?
Okay. The whole, had a lot kind of in it.
Yeah.
A lot of, Portland, let's just take Portland. Let's just take Portland as a city. 3 times we voted, voted out 4 times, 3 times it was voted down. 1 time it was voted in, and then 2 years later it was voted out. I believe that was 1980. The recent history is far more germane to our situation now. Last summer, there were all kinds of meetings being held within the city and with organizations to fluoridate. And we've got some internal documents on this, and I could even show you those. And none of us knew it. None of us knew what was going on until the Oregonian broke the story August 9th that Randy Leonard was introducing a measure to fluoridate Portland's water. Nobody knew it. The mayors of the outlying cities didn't even know it. They were the ones that were buying Portland's water. Even they didn't know it. They've been totally kept in the dark. Within a couple of weeks, Sam Adams, Nick Fish had already right on board saying, yeah, we're supporting it. There's 3 out of 5 city commissioners. And it was a done deal. We never even had a chance to organize, to talk to any of these people. It was virtually a done deal. August 9th, September 12th, the vote was held. They made the decisions even before the public hearing was held. It was a done deal. This was an outrage, frankly. It was done like this. And it was done on purpose. This had been planned for many, many months. And people were very upset. When it came time for us as a volunteer organization, a bunch of people got together and didn't even know each other. Most of them said, we've got 30 days to collect at least 20,000 signatures. The most amazing thing I've ever seen. We did it, collected over 40,000. Most of them were people against fluoride, but I'd say 10 or 15% were people that were for fluoride, were so upset with the Portland City Council and how they acted, they said, yes, I'll sign that because this isn't right. This was done behind closed doors, and it was. And this is not the way we think a city should be run. And by the way, a lot of these organizations, the local ones that have signed on, they signed on right then, very quietly, never had a chance to actually sit down and talk with us. We never had a face-to-face conversation to present the information that I presented to you today.
Phil?
Okay. Well, I can't comment on the history of the votes here in Portland because I wasn't here, which was quite a while ago. But again, I think sort of dovetailing on what Rick said, I can't comment on the city council process because I wasn't a part of that and don't want to speak for others. However, I will step back and say that it is within the tradition of what our elected officials are charged to do, which is to take care of public health issues. That is part of their responsibility. That is part of the responsibility of city, state, and federal government, which is to deal with public health matters. That's why we don't vote on it. We don't vote on things like whether we have to wear seatbelts. We don't vote on whether or not you can smoke in public. We don't vote on whether kids under 16 can or cannot, or should or should not wear bicycle helmets. These are voted on by our elected officials because they are charged with the responsibility of handling public health and safety issues. Yeah, so that's kind of the general context. And so it was, in that sense, perfectly appropriate for the city council to vote on water fluoridation, because that is within their charge. Now, for a number of political reasons, you could debate that issue in this particular case. But again, I wasn't a part of that, so I don't want to comment on the actual inner dynamics of what happened.
Does somebody have a burning thing that needs to be asked? Did I miss it?
burning thing?
Yes.
Yeah, I'm just curious how much the discussion has kind of, seems like it's glazed over a little bit, like where we get the fluoride from, and I'm not really clear as to why that's being so heavily glazed over. You know, like the source of the fluoride
Sure.
being byproduct
Sure.
of industrial waste, fertilizer,
Sure.
chemicals, and I don't consider that personally. Washing my teeth with that doesn't sound
Sure.
super appealing, so I'm wondering if you could
We'll
respond to that.
start with Phil.
Yeah, I'll answer that first, and I know that Rick will have his take on it as well. So, fluorosilicic acid is a byproduct of earth. I mean, we happen to have certain kinds of rock that are rich in phosphates. And so there are several byproducts of this type of earth that are useful. Well, some would say maybe some are not useful. But one is phosphoric acid, which goes into Coke and Pepsi. We've already talked about sweetened beverages, so that's a whole nother issue about whether that's worthwhile or not. But phosphoric acid goes into soft drinks. Another byproduct of this same rock is fluorosilicic acid, which is used to fluoridate water. A third byproduct are phosphates that go into the fertilizer industry. So that is the genesis of where fluoride comes from. It is inaccurate to say that the fluoride that we use to fluoridate water is a byproduct of the fertilizer industry. That would be as accurate as saying that phosphoric acid that goes into Coke and Pepsi is a byproduct of the fertilizer industry. All right, it's a three-legged process. Now, as the Oregonian commented, fertilizers are used in our soil for a number of purposes, some of which are to promote food. Now, we can argue about the value of that, all right? But many people would say that's not a horrible thing. And so the Oregonians' final comment on their editorial from a few days ago was, let's fertilize healthy teeth. That was kind of their sarcastic bottom line response to this whole argument about fluorosilicic acid being a product of the fertilizer industry.
Rick?
Well, one thing on this particular issue, I've been appalled at what the Oregonian and then what the Willamette we put out today, which was one of the most incredibly inaccurate, totally false, I mean, just fact after fact after fact they got wrong. I've never seen anything like this. I freely admit that. I mean, I've been in public health for over 30 years. I have never seen an issue like this, ever. To this particular point, you can talk about Coke and Pepsi, Phil. I don't know about the phosphates that go into Coke and Pepsi. What goes to fluoridate water is a hazardous waste. This is fluorosilicic acid. That's what it is. It's in the scrubbers and they got to get it out. They cannot put this in water. They cannot put this in the air. They have to dispose of it. If it's not sold, it's a hazardous waste facility. Now, I think you could probably put Coke or Pepsi in water, and it won't be classified as a hazardous waste. This is what's going on. We know. This is all a matter of public record. We know it's got heavy metals in it. It can be, and they don't test every batch, so you don't know. We know that of the batches they did test, 43% had arsenic. We know that the batch that went to Phillip, that we had directly go from Phillip to the lab in Washington and sent back the results, we know that had higher levels of arsenic. And we know from standardized math done through the EPA's methods that that is going to increase 5 cancer cases per year in the Portland area. That's just the extra arsenic. That's not even counting the possible leaching of lead. That is not counting the big one in the tent here, is fluoride itself. It is harmful to our health. When you're putting it in the water, we have no choice. Right now we got a choice. It is not ethical. And the entire premise of putting a drug in the drinking water, the only one that has ever been done, ever, Are you gonna put Lipitor in there because some people have heart disease? You're gonna put Prozac in there because some people have mental problems? God, I hope not. And yet we're doing the same thing. You can't put a drug in and not expect harmful side effects when there's no control for dose. It makes no sense whatsoever.
Joey, I have another question too, just a process question.
Yes.
Is this a yes or a no and that's it? Has each side come up with a compromise, or is it just vote yes or vote?
Yes or no.
It's
It's a
yes or
yes
no,
or
up
no.
or
There's
down.
there's
That's it.
not a
Yeah.
different vehicle or another different where that we
Not at
can
this stage.
win and win?
Yes or no, that's it.
That's it.
That's it.
Yeah.
That's it. It was yes. Before, I mean, the city council, you had 5 people on city council making a medical decision that none of our doctors could make. To give us a drug without our informed consent.
Well,
So at least we've got a vote. It scares me that it's gone into the political process. I don't think it should ever be in the drinking water in the first place.
of course,
But at least we got a vote.
many of us will argue about the whole premise that fluoride is a drug.
Right. Right.
I've got
So-
the sheets from the
Right, that's
FDA
right.
right here for anybody to see.
Let me stop right now and just say, I'd like that some people were sensitive to time and have other obligations. It's 20 till 7 now, and so I'd like to end the formal part of it. If anybody wants to stay, I hope you do. And you're welcome to gather around or have individual conversations. And I just want to thank Rick and
Thank you.
Phil for being here, and thank all of you. Thanks, guys.